I'm sure you are familiar with the Maio codes, where we have specific areas with specific volumes, with specific indications with needles or cannulas. So for those who are not familiar, I recommend to read these recommendations. Here you have areas like CK1, very safe to use because there are no major vascular structures in this area. Then you go into the more red zone, which is the CK2 and CK3, because you have here the zygomaticofacial and the infraorbital foramens. So this is something that you need to consider. And you can see there are many other areas related to mostly arteries that you need to respect and know in detail. Just to go more in detail into this area, here you have the CK1, which is the cheeks. Here you can achieve nice lifting by injecting periosteal with needle by using 0.1, 0.1, 0.1 cc's, or you can use also a cannula to give you a more of the top model look. You can use 0.3, 0.5, even one filler on each side, depending on each patient. Then you have the CK2 and CK3 areas. Again, remember there are more vascular structures here. You can use here in the CK2 a needle, supraperiosteal always. And in the CK3, my suggestion is to use cannula. You go medially, from lateral to medially deep. Be careful with the infraorbital foramen. Here you have more in detail where the structures are, where are you going to inject, and where are the most crucial, critical arteries and veins that you need to consider when you treat the midface. And here, just going more into the lower face, and I don't want to go into detail in that area, but here the nasolabial is another area you can treat depending on the degree of bone deficiency, depending on how deep are the lines in the nasolabial fold. You can use deep periosteum needles or cannulas that you can go from half a syringe up to 1 syringe, depending on each case.